The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining the webinar. My name is Charlie Irwin, Broker Development Manager here at Careington International. Definitely grateful that you guys joined us on this webinar, and look forward to working with you in the future as well. This is our marketing partner guidelines. Basically what that means, it's a compliance webinar. So we're going to go over how to not only sell our plan successfully, but how to keep compliant. Here at Careington, we're of course proud of our products. We're proud that we've had a successful business for over 30 years. But more importantly, we've done the business the right way. We believe in staying compliant, doing things right, and of course selling our products the compliant and right way. So we definitely want to share how to sell our products the right way, and of course to be successful in doing so. So this first slide is a little bit about Careington. I know most of you guys have been selling our products for a little while, but just as a 30,000-foot overview, we've been around since 1979. We own some of the largest dental networks in the nation, but we're also an aggregator of products. So we actually have over 100 different products that we offer. We have our own customer service on site. We have technology solutions, our own fulfillment and marketing support, all in-house as well, which is a pretty cool thing that we're not outsourcing, different areas, that we do it all in-house. We're also a licensed TPA through our company, Careington Benefit Solutions. So that's more with some of the self-funded plans, administering insured dental plans, and things of that nature. I know for you guys as agents and brokers, it's going to be more selling our product plans, so mainly dental, vision, and telemedicine. But as I said before, we have many other products and services that you have access to as well. And a lot of that's going to be more for the larger groups like associations, large employer groups. But again, mostly dental, vision, and telemedicine is what you guys are offering and do a good job in selling. So we'll go ahead and get started with the compliance webinar. There we go. So DMPO regulations and guidelines. DMPO, excuse me, I have a little bit of a cough, so bear with me. DMPO is a discount medical plan organization. Basically, what that means is the regulations on discount plans. What we're saying here is you're going to need to demonstrate full compliance with discount medical plan guidelines. And that's what I'm going to help you with today, as far as what those guidelines are and how to stay compliant. The guidelines are intended to facilitate with federal and state laws. So different states have different guidelines as far as selling discount plans. Some are stricter than others, and of course we take the most conservative standpoint and to make sure that we're compliant in those states. So that's going to include, when we talk about federal and state laws, the FTC Act, TCPA Act, which is going to be more on the telephone, rules and regulations, telemarketing sale rule, state marketing laws, and state laws governing discount plans. So also, we as a company, not only do we go by state and federal laws, but we have our own compliance rules, best practices that we have here at Careington. And so some of the things that you see are beyond the state and federal laws, even something that's even more compliant, that we as Careington, we take an extra step of compliance to to go over. So keep in mind of that. If you are going out selling our products and you're doing it the wrong way, you're completely going against our compliance guidelines, you're completely going against the way that we want to do business and the right way to sell our plans, you are subject to suspension or termination. So keep that in mind. We don't say that to be the big bad mean guy. Again, we want you to be successful in selling our products. And of course, the first layer to be successful is to stay compliant and do it the right way. So here's going to be some basic requirements. A lot of this is common sense, but again, we go over this just to make sure everybody understands the same things that we're talking about. So talking about, you need to comply with all relevant laws and regulations, conduct business solely using your own legal name. Excuse me. So again, what that's saying, whatever you're contracted with us with, if it's your company name, your own legal name, when you're offering our products or going out to the public, obviously, you should be using that name that you're contracted with. Here's a big one. You cannot refer to Careington discount plans as insurance. So that's a biggie. You can't go out there and say, hey, I have this amazing insurance plan that has no maximums, no deductibles, great insurance plan, sign up for this. Obviously, it's a big no-no. Our plans are not insurance. Obtain all required license and registrations to sell discount plans. Now, with that, when we say that, that's more on a wholesale basis. So people that wholesale our plans deal a lot with that. You as a broker know that we take on the burden of licensing our discount plans in all the relevant states. You fall under our umbrella with that. So we take over a lot of those license and registrations. So just keep that in mind, that you don't necessarily have to go to the states yourselves. We already do that for you. Basic requirements, when it comes to your website, you'll need to have a privacy policy on all websites. So disclosing information on what you collect, how you collect the payments. That's if you're selling our products directly on your website. Now, most of you sell the plans off of your landing page. If we're just talking about your agent landing page and not connected to any other website, that somebody's going directly to that landing page, then we have all of that information taken care of as far as collecting the payment, because we ourselves are collecting that payment, and it is our website that we own and operate. So don't worry so much about that. This is, when you're linking that to your own website, or you're putting our products directly on your own website, that's where, of course, you need to abide by and be aware of the privacy policy. We can go ahead and flip to the next slide. Not use high pressure sales tactics. So, what we're talking about there is high pressure sales tactics. Obviously, being respectful to the customers, need to be respectful to them, let them know exactly what our plans are, and go about offering our plans the right way. You will need to notify us within 7 days of any complaint, lawsuit, or investigation. So, obviously we take those things very seriously. So if you're notified about any complaint, lawsuit, or investigation, obviously that involves our products. So we definitely need to know about that within 7 business days. What we would need to know. So when you notify us, we're going to need to know contact information for the person making the complaint, description of the issue, and then what is being done to resolve the issue. Or if you haven't done anything yet, obviously that's something we need to discuss and get on that and help you with. This part is talking about you will need to let us perform a compliance audit on any marketing or sales practices. So if our compliance department or myself or anyone else here at Careington wants to audit either your website or any materials that you may have, then obviously we are allowed to do that. So basically, give us access, comply with that, allow us to do that audit. What this is talking about is you'll need to use the marketing materials that you use will need to be approved by Careington. So anything that you put out there needs to be approved by us, whether that's brochures, email blasts, paper, electronic, literally any type of marketing needs to be approved by us. Or, you know, if we're talking about brochures, that's something we can create and give to you ourselves. Of course, the Careington created brochures go through our compliance process before they get to you. So no matter what, that's going to be compliant. So like I said before, we're talking about mailers, emails, radio, television, online ads. People have tried to get creative and try to get around some things, but no, literally any type of marketing needs to be approved by us. Resubmit marketing pieces if any changes are made. Yeah, maybe we have approved what you're offering. That doesn't mean you can go back and edit it without us knowing and send it out. Of course, we need to approve any changes you make. And again, you can't use any deceptive or misleading marketing materials. Just goes back with doing the right thing and marketing our plans the right way. So substantiate all claims that you make in an advertisement and retain all information and documents as well. So that goes back to you know, really being honest in what you're advertising. And include mandatory disclosures in all marketing materials. So that's a big thing. And when it goes through our compliance department, we're going to make sure you have those disclosures on there. Also, in your agent portal, there is a compliance section that's going to have these disclosures as well. But that's a big thing when offering discount plans, is to make sure they have the correct disclosures on there. This part's talking about you can't use the word free unless everything's, you know, disclosed or if there's something specific, but, you know, using the word free whenever you're selling something is for sure not compliant. And, you know, that goes back to the Federal Trade Commission's guidelines. You need to meet the principles in the FTC guidelines, make sure that disclosures are on there using online or mobile advertising. So also go by the CAN-SPAM Act. So that's when you're doing email advertising, definitely the CAN-SPAM Act is what you need to go by and be approved. So that's what that includes is accurate header information, accurate subject lines, identification as advertisements. Going back to the accurate header and subject lines, say you're marketing a dental plan. You can't put in there amazing free dental insurance and then you're selling a discount plan. Obviously, that would be an inaccurate header line, something that you're actually not substantiating. So it has to be accurate. What you put on those email blasts has to be something you're actually advertising and can back up. You have an inclusion of physical address and A big thing is it needs to have an opt-out message, allowing the recipient to opt out of all commercial emails. That's a big thing that we see quite a bit, is I'll have brokers wanting to do an email blast, but when it comes to the opt-out, they don't have any type of opt-out clause. And keep that in mind. If you want to do an email blast, you have to have a way for them to opt out of the email, or else we won't be able to help you with that. We won't be able to approve your email blast. So this part is specifically for telemarketing requirements. When you're making outbound calls, you need to make sure that they're not on the national do not call list. If they're on that list, you cannot reach out to them. And when you're making the calls, you need to back up that these people are exempt. So you can't just tell us, oh, I'm pretty sure that they're exempt. You need to actually back up that you're for sure knowledgeable that they are exempt from the do not call list. So keep that in mind. When I talk about exemptions, a couple can be they've expressed written consent to be exempt. Another way is if they're an established business relationship. So you have an established business relationship with this person already, and they say, hey, give me a call, I want to add my wife on a plan, then that can be an exemption. But especially if you're doing cold calls to people you don't know, that's something you need to especially be aware of. So you need to implement policies and procedures to honor the do not call list, and make sure that anyone in your organization, if they're making those outbound calls, that they're very aware of who they can reach out to. A lot of that, I'm not going to read all the paragraphs word for word. I know there's a lot of information there. Sharing do not call requests with Careington is a big thing. You can't use our name during any telemarketing campaigns. Any do not call request while you're doing a Careington campaign needs to be made aware to us as well. So keep those things in mind. So you need to have a written do not call policy with do not call procedures. So again, staying compliant with that, having a set plan on how you're going to target these people over the phone, and a set plan on how you're going to be compliant with the do not call list. So you can't do any robo-dialers, so that's pre-recorded messages, and when they're not actually talking to an actual human being is a no-no. You can't send any advertisements or any marketing communications through text message either. So keep those in mind. So again, this section is going to be talking, you can't make any calls using an auto dialer. So, whether pre-recorded message or automatically dial someone and a live person's on the other end, if it's using an auto dialer, you can't do that unless you have pre-written consent, prior consent. So, whether that's telemarketing calls to cell phone numbers, or even if it's non-telemarketing calls. So you can't, even if it's a non-marketing call, you can't do that to a cell phone number or any type of pre-recorded way. You need to identify cell phone numbers, make sure you know the difference between if you're calling a cell phone or a home number, and of course go by all state laws and substantiate the exemptions. So again, when making telemarketing calls, not only do you need to be compliant, but if you have anybody underneath you, if you have an agency of people selling our plans, they, of course, need to be aware of these compliant things as well. So we, by all means, can request and set up a compliance training, compliance webinar, and if anybody's selling those plans underneath you, not only do you, but them as well needs to be in attendance for that. We can request that. We can implement policies and procedures, and you know, we as Careington can monitor you and make sure that you're selling our plans the right way. You do need to be registered as a telemarketer in all required states. This is a big thing. We get people that mostly sell insurance that will come to us and say, well, when I'm selling insurance plans, I don't have to be a registered telemarketer. Different story when you're talking to us. Discount plans and insurance, the way that you sell them aren't always the same. With discount plans and with our Careington policies, we're very strict on you being a registered telemarketer if you're doing these outbound calls and doing sales calls. So keep that in mind. We can give you some more information on that if you're doing a lot of phone sales. There are rates that you abandon calls. So you need to be in the guidelines of the requirements set for with the Telemarketing Act. So as far as abandonment rate, no more than 3% of calls can be abandoned. As far as ring time goes, you're looking at 4 times or for 15 seconds. When we're talking about recorded messages, it needs to be within 2 seconds after the consumer's greeting. So those are, you know, some of the requirements for the telemarketing laws. So when you're making calls, there are guidelines of the hours that you need to call. So make sure you know that. You can't be calling people at 3 a.m. trying to do a sales call. Not that anybody probably would want to. But 8 a.m. to 9 p.m., that's going to be your time frame. You can call on any day except Sundays or holidays. Know that as well. Telemarketing scripts. You need to identify who you are. You need to identify the legal name of the company. Also the purpose of the call. You need to say that you are going to, you know, what goods or services that you're selling and the nature of those goods and services. So if you're calling about a dental plan, you know, I would say, hello, my name's Charlie. I'm with Careington International Corporation. And then obviously let them know that I'm offering a dental discount plan through Careington. You know, would you like to learn more about that? Something along those guidelines. Also, you need to let them know that the call may be recorded. And you need to know they'll need to know the telephone number and the postal address of your company. So prior to taking payment, they'll need to know, of course, the cost of the goods and services, any restrictions, limitations, or conditions attached to the offer, and then they'll need to know the cancellation and refund policy. We do have disclosures that you would need to read. So we can, excuse me, when we approve your script, then we'll have a disclosure that we can give you as a template that will have, you know, something along the lines of, thank you for signing up for the Careington plan. Do you authorize us to charge you in the amount of $99 plus a one-time $20 processing fee? So we'll have some language like that, and of course all of the relevant disclosures. Any inbound or outbound scripts need to be approved by us as well. When doing telemarketing calls, of course, caller ID must have the accurate information on it. All calls have to be recorded from start to finish, so that includes recording the disclosure and all relevant other information you share on the calls. And then as far as the recordings go, the storage practices must comply with the PCI industry and data security standards, so you do need to record those sales calls. So to kind of piggyback off of the recording, you need to keep all records related to marketing, telemarketing for at least 5 years. My apologies again on that cough. For at least 5 years, and provide them to Careington within 10 business days. So again, here's more record keeping requirements. I'm not going to read every single word on this list, but hit some of the highlights. So copies of all scripts, advertisements, marketing needs to be kept. Of course, all recordings, your internal do not call list, proof of do not call exemptions, abandoned call safe harbor records, of course, any quality assurance forms as well will need to be kept. So not only that, on the phone calls and do not call list, but employee records, so including the employee name, any other name used, job title, documentation of compliance training as well. So, you know, if you have, again, other agents, other people in your company selling our plans, need to keep records of that, especially in case they're doing anything fraudulent. When we're tracking down who did that, obviously we'll need to have all the relevant information. Also customer records. So who you reached out to, when you reached out to them. Obviously, if it's a phone call, you'll need to have those recordings and make that available to us as well. So next slide. Again, you'll need to notify us and keep records of complaints, lawsuits, and investigations. So now that we went through all of the fun compliance information, thank you so much for being attentive and staying with me on everything. Obviously, it's very important. This section is going to be more on our product, but it does have a lot to do with compliance, especially this slide. Like I said earlier, you cannot refer to our plans as insurance. We do not sell insurance. Our plans are not insurance. They are discount plans. This is a great chart on the difference between discount plans, otherwise called, so you can see their savings plans and insurance. Our plans do not have waiting periods. There's no claim forms, deductibles, no annual maximums, no limits on use. Those are some great things. So when you're telling people, you can spin it in a very, very positive way. For example, hey, I want to let you know about these amazing Careington plans. They're not insurance, which is a really good thing. Reason being is no waiting periods. There's no annual maximums, no limits on use. So you can spin it in not insurance, but we're very proud of that because of these reasons. Some good selling points about our dental that we offer. Excellent option for people whose benefits don't include dental care. I tell you what, with the ACA that came out, you know, the past few years, because the rising cost of healthcare, there's an alarming amount of companies that totally did away with dental. Said, you know what, healthcare has risen, so you're on your own with dental. we're not going to subsidize that. We're not going to even offer it. So great option for those people who don't have dental, or for reaching out to companies who don't offer it anymore. Our dental plan gives deep discounts. So whether that's cleanings, checkups, x-rays, you're going to get huge savings with our plans. Not only that, not only just the basic procedures, but we're talking about cosmetic dentistry is discounted, braces, root canals. This is huge. So you might talk with someone saying, I don't know, maybe I haven't heard of a discount plan before. I don't really know about that. So we went over a few of the reasons why our plans are good. There's no waiting, no limits to how many times they can use it. Another huge thing is cosmetic dentistry is discounted. A lot of times insurance plans aren't going to discount whether it be implants or veneers. Our plans do discount that. So that's a huge thing. We offer a huge network, so there's plenty of dentists to choose from. And we're really proud that we offer member transparent pricing on our dental plans. So what does that mean? When we talk about transparent pricing, is customers know exactly what they're going to pay whenever they go to the dentist. And we let them know that. There's many plans, many other discount plans will say, you know what, most procedures you'll get a 20 to 50% discount, but that's all the information they get. They go in for a crown, they have no clue what discount they're going to get. With Careington, we provide the transparent fee schedule. So you're in the state of Texas going in for a crown, you have the set dental code, you'll see exactly what you're going to pay so that there's no surprises. That's a big selling point and something that's really great for our customers. So dental is huge for us. Also, vision is big as well. So sell a lot of vision discount plans. Most of the time, it's going to be tied with our dental. I've noticed our brokers love to sell the dental and vision combined plan just because it adds a ton of value. So they're going to save money on eye exams, eyeglasses, contact lens exams. Works a lot like the dental in that they go to a provider that's in the network, and they're going to pay discounts on those procedures. Why are vision exams, why is that important? Obviously, you want to see well, but also they can detect glaucoma, more severe things whenever you go for your vision exam. So that's something else that's very important. Third product that we offer that is huge is telemedicine. I'll go into a little bit more detail just because telemedicine is huge right now, but there's still some people out there that don't really know exactly what it is. Telemedicine gives you access, when I say access, 24 hours access to licensed physicians that you can call. These physicians can prescribe non-narcotic medications if needed and send prescriptions to your local pharmacy. Cost of the consultation with these physicians is zero. No cost to call them. So as you can tell with my cough, again, I apologize for it, but just yesterday I used the telemedicine offering that we have. Called up, a nurse answered the line, asked me what was going on, made sure my health records were up to date, and then they don't guarantee 15 minutes, but with me yesterday, it took less than 15 minutes, and I was speaking to a licensed physician. Told them about my cough that you've unfortunately had to hear through, the congestion, what's going on. They prescribed some antibiotics, picked it up at my local pharmacy within the hour. Did not cost me anything to speak with that physician, saved me a trip to the doctor, Save me a trip potentially to an urgent care, minor emergency room. Saves me a ton of money by having telemedicine. So this is huge. If you're speaking to employer groups, if you're speaking to individuals, also if you're speaking to employers that are self-funded, this is going to save them all sorts of money. As opposed to them, again, going to the emergency room, spending at least $1,000 to $2,000. Doesn't cost them anything to call a doctor. So we'll go to the next slide. Telemedicine at a glance, again, 24/7 access to physicians. I mentioned by phone, there's also video or email capabilities as well. And unfortunately for folks in Arkansas, as of now, they cannot utilize telemedicine, so keep that in mind. Keep in mind our products can be added to new or existing insurance plans as value adds. So what that means is because you signed up for the XYZ health insurance plan, you automatically get dental, vision, and telemedicine through Careington. So for carriers and insurance agencies, they do have those capabilities. When we're talking about dental insurance, if they've hit their maximum or if they have a 6-month waiting period, that's a great way that they can utilize our Careington product. So you'll come across people that say, no thanks, I don't want the Careington discount plan because I already have insurance. Well, you can follow up, hey, have you met your maximum? They might say, yeah, you know what, I hit my maximum a month ago. Well, perfect. They can utilize our Careington plan. Anything for the rest of that year that needs to have done, they can pay discounted prices on. So, next slide. So this is our, what better way to end a compliance webinar than to have a disclosure, right? So very fitting for this webinar. Just want you guys to know that I am not a lawyer, so anything in this presentation, it's not meant to replace legal advice. I'm not meant to be your lawyer or legal representative. However, I do want to share relevant information on how you can stay compliant. So yeah, again, not meant to be construed as legal advice, does not create an attorney-client relationship between Careington and its partners. Careington recommends that each partner retain its own legal counsel to ensure that you are compliant and that you're compliant with applicable laws and regulations. So there goes that disclosure. Again, my name is Charlie, Broker Development Manager here at Careington. We do webinars each and every month, so I hope you got some relevant information from this and learned quite a bit. We will make this available in your agent portal, so keep up to date with that with your agent portal. You're going to have a section that has previous webinars, so this will be posted here in a few days. So you'll have this on file. Don't worry if you didn't memorize all of this. Again, you'll have access to it. Of course, let us know if you have any questions whatsoever. We do have that chat function there. If you miss us on the chat function with the webinar, reach out to us, brokers@careington.com, or of course, there's my contact information as well. Thank you so much for your time, and we look forward to future webinars.